So the initial investigation for the diagnosis of obstructive sleep apnea syndrome is pulse oximetry, and the gold standard is polysomnography. And the treatment option include weight loss and stopping alcohol and CPAP. And in children, sometimes surgery is indicated. The obstruction is due to adenoids or tonsils. So surgical treatment is also an option in children. Next topic is restless leg syndrome. What is restless leg syndrome? Restless leg syndrome is basically a funny sensation. Uh, for example, insects crawling over the legs, aching or tingling, sometimes pain over legs, especially at night. So someone with a sensation of insects crawling over his legs or pain that is worse at night or during the evening time, and the pain resolves or the symptoms disappear after moving the legs, you will think of restless leg syndrome. A theory suggests that restless leg syndrome is due to a decreased level of dopamine or iron in the body. So, a decreased level of iron or dopamine can lead to restless leg syndrome. And as normally, dopamine level are depleted towards the end of the day. That's why the patient symptoms are worse or increase or pain is high at night or during evening because dopamine levels are depleted throughout the whole day, and the evening they are very less. That's why the symptoms are worse at night or during evening. So, sir, do you want to ask anything?
No, it's just that my screen was completely, it was gone. It's okay. Thank you. It's coming now.
So restless leg syndrome is feeling of pain or feeling of sensation of insects crawling over the legs, especially at night, and the symptoms settle down after moving the leg. The diagnosis will be restless leg syndrome. The investigation will be check iron level, and if iron is low or creatinine is low, if there any is not present, you will give iron supplements. And if ferritin is normal, then you will give dopamine agonist for the treatment of these symptoms of restless leg syndrome. Usually, most of the time, restless leg syndrome does not require any treatment. Only lifestyle modifications such as avoidance of alcohol, smoking, caffeine, and sleep hygiene. With all these measures, the symptom usually resolves, and restless leg syndrome does not require any treatment. Examples of dopamine agonists include ropeginol and protegotine and ropeginol, which can be given for the treatment of restless leg syndrome. Iron can also be used if there is ferritin levels are low. Our next topic is trigeminal neuralgia. Trigeminal nerve supplies the
These medications can only be given by the consultant, or it's just like the GP can give them as well.
GP can prescribe iron supplements if ferritin level are low. Dopamine agonists can only be prescribed by the consultants.
Okay. That's
So trigeminal nerve supplies the face. It's a mixed nerve. It has a sensory supply as well as a motor supply. And the motor supply is to the muscles of mastication, and the sensory supply is to the face. There are three branches of trigeminal nerve: ophthalmic, maxillary, and mandibular nerve. So, what is trigeminal neuralgia? Trigeminal neuralgia is electric shock like pain or sharp or shooting pain in the vicinity of trigeminal nerve that gets worse on chewing or movement or touch. So, electric shooting like pain or sharp shooting pain on the one side of face that gets worse on chewing or movement or touch, you will think of trigeminal neuralgia because it's a neuropathic pain or pain due to problem in the nerves. So the first line medication for treatment of trigeminal neuralgia is anticonvulsant medication such as carbamazepine. Other than carbamazepine, lamotrigine, phenytoin, and gabapentin, all of them can be used because basically the function of carbamazepine or lamotrigine is that uh, they basically cause nerve depression or stimulates the GABA neurons or inhibitory neurons or decrease the activity of the neurons. So that's why carbamazepine is the first line drug for trigeminal neuralgia because it decreases neuronal firing or decrease the activity of neurons. So it will relieve the symptoms of pain, which is due to trigeminal neuralgia. If there is no improvement with the drug carbamazepine, then surgery can also be tried. And the cause of trigeminal neuralgia is basically compression of the nerve or trigeminal nerve by the surrounding blood vessels. So during surgery, microvascular decompression is done, which relieve the pressure on trigeminal nerve, and thus the person's symptom will improve after the surgery. So sharp shooting pain in jaw that is worse on chewing. Diagnosis will be trigeminal neuralgia. First line treatment for trigeminal neuralgia is carbamazepine, which is an anticonvulsant drug. And the second line treatment option is surgery or microvascular decompression. Is it clear to everyone? Is there any question anyone want to ask up till now? Our next topic is facial palsy. Facial palsy, you all know that facial nerve supplies the muscle of facial expression. So whenever there is facial nerve palsy, the muscle of facial expression will be paralyzed. So facial palsy, there are two types of facial palsy. Facial palsy can be upper motor neuron type of facial palsy, and facial palsy can be of lower motor neuron type of facial palsy. The difference between them is that in upper motor neuron type facial palsy, remember that upper motor neuron upper face is spared. So if there is problem only with the lower face, this area, if there's a problem with the lower face, then we will call that and a wrinkling of head and closing of eye is not lost, it is intact, or the upper face is spared, then we will call it as upper motor neuron type of facial palsy. And if the whole face is involved from head to chin, then we'll say that it's lower motor neuron type of facial palsy. There's one other term which is known as Bell's palsy. Remember that if the cause of facial palsy cannot be identified, or if the facial palsy uh, is idiopathic, no cause of facial palsy can be identified, then it is called as Bell's palsy. So Bell's
Sorry,
palsy is
could you
basically a
repeat that again?
facial palsy which is idiopathic, for which no cause can be identified. That facial palsy is called as Bell's palsy. So facial palsy with no cause is Bell's palsy.
So, what will be the expressions in this condition? Will there be a upper face will be spared, or the whole face will be involved
In
in
Bell's
Bell's
palsy,
palsy? Yes.
Bell's palsy is basically a lower motor neuron type of facial palsy. A upper motor neuron type of facial palsy only occurs in stroke or in brainstem lesion. So if there is upper motor neuron type of facial palsy, then we can say that there is problem in the brain, due to which facial palsy has occurred.
Right.
For example, there is a cerebral stroke which can result in facial palsy, and there is a brainstem stroke, or more precisely, there is a stroke in the pons area because the cranial nerve 7 originate from the pons. So facial palsy, upper motor neuron type of facial palsy can occur in these stroke syndromes.
Right.
While on the other hand, the Bell's palsy have no cause, or no cause can be identified, or idiopathic uh, facial palsy is basically Bell's palsy. So in Bell's palsy, the symptoms will be of lower motor neuron type.
Okay.
Whole half of the face will be involved. There will be the patient will be unable to close his eyes, and there will be loss of wrinkling of the head.
Sorry, you said it will be lower motor facial palsy in Bell's palsy.
Yes,
Okay.
lower motor neuron type.
Oh yeah, yeah, yeah.
Lower motor neuron type means whole of the half face will be involved.
Mm-hmm.
Upper motor neuron type mean upper face will be sphered.
Right.
Lower motor neuron type doesn't mean that only lower face will be involved.
Right.
Lower motor neuron type means whole of the half face will be involved.
Right.
As you can see in this diagram,
Yeah.
if we say this is the left side of the patient, so there is left facial nerve palsy, and the face is deviated to the normal side or to the opposite side. Remember the rule of 17. What is the rule of 17? 10, 10 plus 7 is 17. Cranial nerve 10 lesion and cranial nerve 7 lesion. In both of these lesions, the face or the muscle will be deviated to the opposite side. In cranial nerve 10 and 7, the face will be deviated to the contralateral side in case of facial nerve, and uvulva will be deviated to the opposite side in case of vagus nerve lesion. While there are two other nerves, one is, as it's a rule of 17, so cranial nerve 12 and cranial nerve 5. 10 and 7 to the opposite side, 12 and 5 to the same side. So we all know that cranial nerve 12 or hypoglossal nerve, it supplies the muscle of the tongue. So if there is lesion of cranial nerve 12 or hypoglossal nerve, the tongue will be deviated to the side of the lesion. So if someone's tongue is deviated to the right side, then a right-sided hypoglossal nerve will be damaged. And as I told you that trigeminal nerve supplies the muscles of mastication. So in case of trigeminal nerve, the jaw will be deviated to the affected side. So if the jaw is deviated to the right side, then we'll say that right-sided trigeminal nerve is damaged. So in short summary, remember the rule of 17 to tell which side nerve is affected. What is the rule of 17? Cranial nerve 10 plus 7, they adds up to form 17. So both of them will result in, so if there is facial palsy and the face is deviated to the right side, then which facial nerve is affected? In case of facial and vagus nerve, it will be opposite, contralateral to the side of the lesion. So if the face is deviated to the right side, then it means left facial nerve is damaged. And if face is deviated to the left side, then we'll say right facial nerve is damaged. Similarly, if you vulva is deviated to the right side, then left vagus nerve is damaged. And if you vulva is deviated to left side, then right vagus nerve is damaged. Is it clear, everyone? Everyone following
Yeah.
me?
Yes, I am.
I just wanted to ask you about this cranial nerve rule of 12 and 5. So whenever there is a lesion on in 12 and 5, will it be deviated to the same side?
For 10 and
12 and 5.
yes, in case of 12 and 5, they will be deviated to the same side of the lesion.
For example, the jaw will be also deviated if there a lesion is on the right side.
As trigeminal nerve supplies the muscle of mastication,
Yeah.
and if there is a damage to the trigeminal nerve, muscle of mastication will be paralyzed. So if there's paralysis of muscle of mastication, the jaw will deviate to the affected side. For
Okay.
example, if the right-sided trigeminal nerve is damaged, jaw will be deviated to the right side.
To the right side or left side?
In case of 12 and 5, they are same side. So yes, to the right side.
Okay, that's fine. Thank you.
Anyone else want to ask any question? Remember that another mnemonic to remember this one is that tongue never lies. So if tongue is deviated to the right side, it means the tongue is saying that the lesion is on the right side. And if tongue is deviated to the left, it means tongue is pointing out that there is a left-sided lesion. So we were discussing Bell's palsy. That in Bell's palsy, a lower motor neuron type of facial palsy will be present, and the treatment of Bell's palsy is prednisolone, 1 mg per kg prednisolone for 10 days is advised by NICE guidelines for the treatment of Bell's palsy. because it is an idiopathic condition or which is immune mediated. That's why immunosuppressive drugs such as prednisolone can be used or effective if patient present to you within 72 hours of onset of symptoms. Then you can prescribe a short course of prednisolone for 10 days. 1 mg per kg is the usual recommended dose along with prednisolone because there is an inability to close the eye. So you can also prescribe artificial tears to prevent eye dryness and keratoconjunctivitis due to dryness. So the treatment of Bell's palsy is prednisolone for 10 days plus artificial tears. Our next topic is cavernous sinus thrombosis. Cavernous sinuses are present in the cranial cavity, which drains the venous blood. All the venous blood of the brain is collected in the cavernous sinuses, and from cavernous sinuses they are drained through jugular vein into the cyst and brought back to the heart. So cavernous sinuses are basically hollow spaces that are located under the brain behind each eye. And cavernous sinus thrombosis, the most common cause of cavernous sinus thrombosis is the infection of cavernous sinuses. How cavernous sinuses can become infected? They can become infected if an infection is spread from nearby areas, such as infection of sinuses. Sinuses are air-filled cavities that are present around the brain. So sinusitis, you can say, that is the most common cause of cavernous sinus thrombosis. So whenever an infection is spread to the cavernous sinuses, thrombosis or the blood will clot in the cavernous sinuses to try to prevent the spread of infection to the other areas of the brain. Basically, a defensive mechanism in which the blood clots to prevent the spread of infection, and due to blood clots uh, or thrombosis in the cavernous sinuses, the venous drainage of the cavernous sinuses will be blocked. Due to blockage of the venous drainage system of the cavernous sinuses, the pressure in the cranial cavity will be increased. So signs and symptoms of increased intracranial pressure will be produced, such as headache, nausea, and vomiting. And because it's an infection, and the cause of this infection is sinusitis, so a person with a history of sinusitis who present to you with fever and signs of increased intracranial pressure, then you will think of cavernous sinus thrombosis. So the presentation is usually headache, photophobia, proptosis. Remember that cranial nerve 3, 4, and 6. These three cranial nerves, they are passing through the cavernous sinuses. So a person with a history of sinusitis present to you with headache, photophobia, and paralysis of the cranial nerves 3, 4, and 6. You all know that a lesion to the cranial nerve 3 will produce ptosis, mydriasis, and down and out eye. A lesion to the cranial nerve 6 will produce diplopia. So if a person with a history of sinusitis present to you with headache and cranial nerve signs of 3, 6, and 4, you will suspect cavernous sinus thrombosis. And you will confirm your diagnosis by ordering a CT scan of the head. We will confirm our diagnosis by CT scan, and the treatment is, as it's an infection, so broad spectrum antibiotics are given for the treatment of cavernous sinus thrombosis. Along with broad spectrum antibiotics, corticosteroids are also given. to reduce the inflammation and to decrease the sign of increase intracranial pressure. So this was all about cavernous sinus thrombosis. Is it clear to everyone?
Yes, doc.
Okay, thank you. The next topic is diabetic amyotrophy. This is just like diabetic neuropathy. The only difference is that here the structure that will be affected is muscles, proximal muscles of lower limb and upper limb. So a person who has a history of poorly controlled diabetes mellitus present to you with severe thigh or leg pain that is followed by proximal muscular wasting. How proximal muscular wasting will be described in the Plab 1 scenario, that inability to climb stairs or inability to stand from a seated position or inability to perform daily activities, then you will think of diabetic amyotrophy. The management of diabetic amyotrophy is a good management or good control of diabetes. And if there's a good control of diabetes, then the symptoms usually resolves within 2 to 3 months. Now, the last topic most probably is Gerstmann syndrome. What is Gerstmann syndrome? A person inability to write, inability to calculate, inability to distinguish the fingers of the hand, and confusion in the left and right side of the body. So this is called Gerstmann syndrome. Ability to write and ability to calculate and ability to differentiate between right and left side of the body. These are the functions of which part of the brain? Can anyone tell me?
Temporal lobe.
Temporal lobe. Temporal lobe is in temporal lobe only Wernicke's area is present.
Sorry,
So
parietal.
yes, parietal lobe.
Yeah.
This is the function of parietal lobe. So in Gerstmann syndrome, there is involvement of parietal lobe, and the person is unable to write or unable to calculate or unable to differentiate between the right and left side of the body. Then again, a topic, transverse myelitis. Transverse myelitis, we discussed transverse myelitis as a complication of multiple sclerosis. There are some other causes of transverse myelitis as well, such as viral, bacterial, and fungal infections that affect the spinal cord, which leads to the inflammation of the spinal cord. Whenever there is inflammation of the spinal cord, we all know that in spinal cord, all the ascending and descending tracts are passing down, and also urine and fecal control is also through spinal cord. So depending upon the area of the spinal cord involved in transverse myelitis, there will be symptoms of sensory symptoms, or there can be motor symptoms as well, such as spastic quadriparesis or paraparesis. If lumbar spinal cord is involved, then there will be paraparesis or weakness of both of the lower limbs. And if cervical spinal cord is involved, there will be symptoms of spastic quadriparesis or weakness of all the four limbs of the body, along with the urinary urgency and retention, and sensory symptoms as well, such as loss of pain and temperature sensation, and loss of fine touch and proprioception as well. Then the last topic is DVLA summary. When you need to inform to DVLA, remember that whenever a patient has a condition that need to be informed to DVLA, first you will advise the patient to inform DVLA. If the patient refuses to inform DVLA, then it will be the responsibility of the doctor to inform DVLA. Someone with obstructive sleep apnea, if there is mild obstructive sleep apnea without excessive sleepiness, then you need to advise him to stop driving because it can be dangerous if he keep driving. And also you will ask the patient to inform DVLA. Again, in all the cases, if patient refuses to inform DVLA, then the doctor will inform DVLA. In case of epilepsy, epileptic can only drive if they are seizure free for the last 1 year, seizure free for more than 6 months, if anti-epileptic medications were changed. Patient with dementia cannot drive. They need to inform to DVLA. Transit ischemic attack. Patient who has a transient ischemic attack, they need to stop for driving for at least 1 month, and there is no need to inform DVLA if there is a single transient ischemic attack episode. So on this ends our neurology chapter. This was all about neurology. Now tomorrow, and there will be no class tomorrow and day after tomorrow. We'll have our next class on Monday, and we'll start cardiology. And after finishing cardiology, there will be a mock test from neurology and from cardiology as well, like we did before. And also, as you have time tomorrow and day after tomorrow, so I would advise to read neurology from Plab keys and then from Plabable. For tomorrow, and on Sunday, the ones who are having exam in February, they can do ENT and I on Sunday. One of them can be done on Sunday. They can do it on their own, and if they have any difficulties, they can ask me on WhatsApp.
You said ENT and I.
You can do one of them from Plab keys or and from Plabable as well.
Okay.
Either ENT or I.
You mentioned about some medications You said you discussed at the end of the session that are also in pharmacology. So
Yeah, I saw the medication which are a part of neurology chapters such as carbamazepine and sodium valproate
right.
and phenytoin, etc. That we give to the patient of different neurological diseases.
Okay.
But no details are required for these medication, just their mechanism of action and side effects.
Okay.
So
Alright.
I guess that we'll do in the pharmacology chapter.
All right. Yeah. Thank you.
So the task for you people for tomorrow is to do neurology from Plab keys and Plabable. And the day after tomorrow on Sunday, you will do either ENT or I from Plab keys and Plabable. And I'll see you guys on Monday, and we'll start cardiology. And also, if you want to watch ECG videos, then I have uploaded them on YouTube. You can watch them as well. It will save our time, and we will cover cardiology in 3 to 4 days.
Okay. That's fine. Thank you very much, Dr. Shah.
Okay. Until then, it's a goodbye from my side. Take care,
Okay.
Allah
Thank you,
Hafiz,
Doc.
and good night.
Allah Hafiz.
Thank you.